Welcome to the Man-Ology Project podcast. I am your host, Quentin Crumby, and on this channel, we're going to be discussing what true manhood looks like as we understand our value, our identity, and our purpose as men using godly principles. Now let's get to it.
Hey, what's going on, everybody? Once again, this is the Man-Ology Project podcast, and of course, I'm your host, Quentin Crumby. And listen, man, I got a great episode for us today. This is the beginning of the new year, 2021. We know 2020 was so crazy and out of control from the virus, the COVID virus. And so we want to kick this new year off for all of our men. We talked about mental health to end last year. And so now what we want to do is walk right into this year, talking about our yearly physical checkups. Now, this is crazy, man, because I know we do not like taking or going to the hospital, period, let alone to go get picked and probed and told how bad we are, how overweight we are, and how we need to change our diets, right? I know most of us think about, just leave me alone, let me be. But this is the thing, fellas, we're not getting any younger, and we need to understand the process from our 20s to our 50s on why it's very important to have those yearly checkups. So what I did was, I'm no expert, I'm no doctor, but what I did was I went and got a good friend of mine, Dr. Snell, Jamie Snell, who will be joining me in a few minutes here. And he's going to help us dissect and go through what should we be asking our doctor when we're there, starting from like our 20s all the way to our 50s. All right. So I want you guys just to welcome my new good friend here, Dr. Jamie Snell.
Evening, Quentin.
Hey, how you doing, buddy?
Doing great, man. Glad to be here.
Yeah, man. Listen, I'm happy to have you back on here for the second time. That's the second time, people. Second time. You know that. That means a lot to me, man. It's 2 times. That means
pretty well the first time, then.
Right. 2 times make me feel really good, and so I'm very happy to have you back on. But like we had talked before, man, we both just agreed to connect for the whole year and to bring a comforting, more comforting situation to the understanding of the hospital, how important it is for us to get there, be there, get checked out, and not be afraid of what the doctors may tell us. So I brought you on here so that you can continue to comfort us and let us know as men how important it is, but also clear up a lot of information around the he say, she say.
This is definitely the age of misinformation. So we're here to kind of make sure that folks are being educated and educated with the facts.
Yeah, man. So now listen, before we kick off, though, we didn't do it live last time. And so we are live today, man. So why don't you do this, kind of give a little bit of background on what you do, how you do it, and, and all the other things that you have gotten yourself into as a doctor.
Sure. Yeah. So as Quentin said, the advice that you trust really has a lot to do with the source, where it's coming from. And I definitely think as Black men, hopefully Black men, that your audience can see themselves in their own reflection. Our voices will carry a little bit more weight. So a little bit about me. I'm originally from Baton Rouge, Louisiana, born and raised in the South. Went to college at Florida A&M one time for the HBCUs.
Yeah, baby.
And then went on to Harvard Medical School, where I got my MD. From there, I spent a lot of time doing work in global health. I spent a lot of time in Africa and South America, really just seeing how medicine is practiced outside of our country, which was enlightening.
Yeah.
I found that the specialty that drew my attention the most was anesthesiology. So I went to NYU for anesthesia residency and then did more training. I did a pediatric anesthesiology fellowship in Boston after that. And a little bit afterwards, I met my wife. She's a Detroit native. Made my way over here to what I think is one of the greatest cities for African-American success, just because I see entrepreneurship around me. I see ambitious folks who, the Black community in Detroit's amazing, but
it
is where I call home. I work at Children's Hospital of Michigan. I'm the director for sedation services there. I'm also a clinical professor at Michigan State University, Central Michigan University, and Wayne State University. And through those programs,
I forgot how long the list was, man. I love it.
I should keep it short. But my passion really comes with the things that happen outside of the hospital. I work at a nonprofit in Southeast Detroit, which focuses on refugee health. And the most impactful thing that we can do goes beyond one patient in front of you. And what I mean by that is that health education has the potential to reach dozens, if not hundreds of people. And so these types of engagements and activity with you, Quentin, in a show like this, to me is really where, my role and my service as a Black physician, and I think is where it plays out.
Yeah. And that's the thing of that. And that's what we really want to do. It's not really recreating the wheel. I think we just need to really just continue to just do our part. And I think spreading, like you said, that misinformation around health and what we need to do as men and keeping ourselves together, man, I think it's just a lot of misinformation out there. And so, let's jump right on in on, the topic today is really, what are we to ask the doctor when we're there? I found this article, and me and Dr. Snell, we read the article. It's an awesome article, and it really just dives in. It's going to take us from our 20s to our 50s. And I'm going to start off with this, like for the 20s. So when I was in my 20s, I never thought about going to the doctor.
Right.
Like, I think as soon as after my mom, like after I was under the thumb of my mom and my dad, then going to physicals and all of that stuff just kind of went out of the window. Like, I don't even know if my mom even reminded me to go to the actual doctor to actually have any physicals every year. But the one thing that really stood out to me with the article that we were reading is at 20, the health isn't very important, but they really drove in on the mental health.
Right.
They really went in on the mental health when you're in your 20s because of the culture, so much pressure, so much pressure to be fit, and so much pressure to be this, and so much pressure to be that. So what do you so being there in the hospital and you're seeing all this, you're teaching classes, so you have a better knowledge around that. But what would you tell kids at 20 or parents that have kids that are 20 that should they still be reminding them?
Well, one way to look at it is, what are the health-related issues that are more prominent for someone in their 20s than, say, someone in their 30s, 40s, or 50s? And by far, the issues that plague men in their 20s, in fact, claim lives, are trauma, violence, car accidents, which are kind of related to that, and just kind of the risk-taking behavior that we're all used to in our 20s. Those are the things that kind of happen in the outside world. Internally, in terms of, what type of conditions or diseases might be more common in your 20s, that's where you run into things like mental health in terms of depression or anxiety. I mean, if we're being honest, it's not hard to imagine that phase of life having a lot of stress that comes along with it, whether you're pursuing your education, it could be a relationship, it can be career, it could be disappointment after disappointment. All of that stuff really can be easily overlooked in your 20s. I mean, you kind of dismiss it. Maybe you treat it with a drink here and there. You treat it with
right.
But the key to this, Quentin, really is the whole idea of preventative health. Yeah. You don't want to wait until it becomes an issue to get help, because it's going to be that much more challenging to turn the corner on it.
Right. On here, they really do, and like you were talking about the mental state, basically because of the indulgence of which we partake when we're in our 20s, whether it be one thing or another. Sometimes we just, not using the old thinker, so we're just kind of free falling out there. But they said basically you really want to be really cautious or maybe more evaluating around that depression, anxiety, attention deficit. A lot of those, when we're in our 20s, we get hit with maybe more of those type of things than we do with the health scares, bad cholesterol and all that kind of, in case you're really just, in case life has really taken a blow. And like, I think you said something that was really important too, is like trauma.
Right.
Trauma sometimes can actually do not only a mental, it can jog your memory or jog your body mentally, but it can also shock you physically. Driving your high, going from your blood pressure is regular and all of a sudden now is elevated because of something that may have hit you that you weren't expecting. So definitely, I mean, my son is 16. And so, like I said, you're under the thumb of your parents. And so, we're making sure he's an athlete. So he's going to the doctor all the time. But when I read this article, I really looked at it and thought, man, even when he's out of the house, I at least try to remind him I can't make him go. But as a parent, I think that, I need to really make sure he focuses on there. And then the second part for you're in your 20s is making sure you get like an HIV test.
Yeah. So if you're sexually active, to be honest with you, so you bring up a good point with regard to the role of parents when you're young, because the question is, what is the trigger that brings you to see your physician? Most of the time when we're in our 20s, it takes a trigger. We're not going because we have this very responsible habit of going to the doctor once a year. We wait for a trigger. Now, if you're sexually active in your 20s, that trigger might be, ooh, it hurts when I pee. Now you're going to go see the doctor, right? And perhaps that's what brings you into the system. But as opposed to waiting for a trigger, you have some symptom that you didn't have before, or you're suffering in a pain from, unexplained pain. As opposed to waiting for that, the best thing to do is to develop a routine. And I think if you can develop a routine for an annual visit in your 20s, then you'll perpetuate it, for the rest of your life. As soon as you get through the door, any qualified physician is going to make sure you have your blood pressure checked and screen for hypertension. So ruling out heart disease, they're going to check your weight and height. So obesity, I mean, as you know, the 20s is when you make that transition from playing basketball for 2 hours every day to by the time you make it closer to 30, things are starting to slow down a little bit, unless you like, Brett Favre, 46. All things aside from being a professional athlete, your weight will potentially start to increase during that time. And you don't want to wait until your pants aren't fitting to realize, like, let me catch obesity and nip that in the bud. And with obesity comes a greater likelihood of things like diabetes, a greater likelihood of heart disease. So even in your 20s, you should be having screening for that. But you make an excellent point. Infectious disease, that's HIV, that's hepatitis C. The other ones, those tend to be symptom driven. But there's the possibility that if you have Hep C or HIV, you have absolutely no idea. Sometimes there's a phase of very mild symptoms, and you might dismiss it as a cold or the flu. But things like, chlamydia, gonorrhea typically comes with symptoms that you're not going to miss.
Yeah. And that's the thing, is that just making sure that you stay on top of it. And I like how you say is that when you're in your 20s, we're driven by symptoms. We're not really it's no routine. It's no schedule. Nothing's on our calendar. But if we do have an itch or a scratch or something, then, we definitely like, I might need to go. And then sometimes, and you may not even go still, you may try to prolong it. As we know, they pass it along. And not really being responsible.
Make it your birthday.
Yeah.
If you make it on your birthday, it's a nice little trigger. That's your trigger.
That's your trigger.
1 year older, let me go ahead and make sure I got an appointment on my calendar to see my primary care doc. Get my checkup.
And the great thing too is that I've, having the kids go, is that you literally can schedule that day for the next one. Like that's that's something also, like, if you guys don't really understand or know that because your wife does it or your girlfriend do it or your mama do it,
Right.
that before you leave, they say, hey, do you want to set up your next checkup?
Right.
And then with our phones today, I'm through Henry Ford. So Henry Ford sends me all my data through my phone. So I get a full mock-up of everything that went on at the
My chart,
hospital.
right?
Yeah, my chart. Yeah. So I'm able to stay on top of a lot of that stuff. I can talk right with the doctors right through my chart, and I don't have to even, you don't have to really go in after you've had the initial physical, because you can really talk through my chart because technology has just done a great job.
Right.
But then when we're moving into our 30s, I found something, and I just couldn't put down a little note, and I was like, that's basically where you really need to start looking at your family tree.
Exactly.
Because they started really diving into high blood pressure, diabetes, blood glucose, high cholesterol, all that stuff. And that stuff could be it could be passed through, down through the generational the family lineage. And so they was like, you really need to have a really good idea of your family tree. So like in my family, my dad has high blood pressure. So that was something that I had to really look at. I didn't. We had an episode in Florida. I'm out there, man. I'm about to order some ribs and everything, and no, not even there. That's not even the worst one. The worst one is when I was at Outback and I was ordering a prime rib.
Okay, I see ribs is a common theme in this story.
Yeah, but I'm eating this prime rib, and I take a couple of bites, and it felt like somebody had two gloves on with like nails in it, and it like grabbed my heart. So I felt like this extreme sharp pain that lit me up. And I pushed the plate away. I told him, I said, you could take that. I'm not eating that. Just bring me a salad. And I felt it. It hit me. Then it went away. And I said, I'm not eating no more prime rib or nothing. The wife set me up a physical to go in. They didn't find anything. It was nothing. I think, I am a Christian. So I think that, I think it was maybe the Holy Spirit, or like kind of nudging me like, okay, you've eaten enough red meat. Cause I was a red meat eater. So,
okay.
But I think I was at a point where it was time to do a detox from my red meat eating. Never happened again. That was a one-time deal. But when we did the physical, and the lady just suggested the cayenne pepper, red pepper flakes,
low salt diet.
Low salt to no salt. If you could do no salt, she was like, do no salt, but Miss Dash, something like that'll kind of help you. And being married, the wife was like, no salt. So she just ripped the whole house.
She was like, I'm keeping you around. You ain't going nowhere.
She was like, and I was in my 30s. And that's really when I had to start. That question came up in that physical, was that they literally went down my family tree. It was like, so your mom, granddad, grandmother, grandfather, on your mother's side, on your daddy's side, on your this, on this and this. And I was like, and I really didn't even I didn't have the answers. I was like, I don't know. I know my dad does because I talked to my dad, but other than that, I didn't have any. And the doctor was looking at me like, you really should know.
Yeah, because this might be unique to the Black community, but when we have a loved one, especially an older loved one who passes away, they died in their sleep. They died of natural causes. Natural causes is never what you see on someone's death certificate, ever. It's not a clinical diagnosis.
Right.
And so when most of us pass away, it can be from a stroke. It can be from a heart attack. It can be from an arrhythmia. Whatever it is, if it happened and that person was in their 50s or maybe even their 60s, that's considered early. Normal life expectancy is up to 72. So anything before that tells us, let me start looking for it early. And that can be anything from heart disease to cancer. And it takes even the guidelines that we're talking about now and pushes the age to start looking for it a little bit earlier. So, for example, if you have a family history of colon cancer, then you're going to start getting screened in your 40s. Whereas if you don't,
Right.
start screening in your 50s. And while we're mentioning cancer, I don't want to forget testicular cancer is the most common cancer in your 20s and 30s. So that's also part of the screening to expect if you're in a younger age group, and it can really sneak up on you. In fact, the recommendations are that you perform monthly self-exams to make sure them boys are equal.
Yeah.
And there's no lumps or bumps.
Yeah. I just saw that and I thought, that's women do that for themselves for breast
Right.
examination. They
Exactly.
do self-breast examination. And it was so funny that I saw that and I was like, well, that's different. Like I would have that's something different. I was like, really? So we're supposed to do our own check, but just look at that, right? So I'm sure that as this video continues to play over and over, and people get a chance to catch these snippets, is that is something that I don't know is actually even preached from your 20s to your 40s, that you should be not only doing your physical, but this should be something that you're checking all the time, because that is something that needs to be caught day one. Because day one, everybody can help you.
That's
and
right.
As that's from what I'm hearing, that everybody is possibly can help you.
Right.
When at day one, and literally from day one on, it shortens up the amount of help that you can receive. So I'm glad you brought that up. Is that testicle cancer is a real big deal, and we as men have to make sure that we're doing our thing. I mean, we're trying to build these businesses. We're having these kids. We had this family. We had all this stuff, and we don't want to get caught up in the grind so much that we're missing the opportunity to take care of ourselves, because look what COVID did.
Yeah.
So COVID is something that actually attacks pre-existing.
Sure. Right. That's right.
I mean, that's one of the factors that, I mean, no different than like the flu or pneumonia. They attack pre-existing situations in your respiratory system, and so if you have high blood pressure and you have pneumonia and you have the flu, that sucker's gonna rise. Like you're not gonna be able to. So you see what I'm saying? Like, so the importance of us actually doing these yearly checkups helps us when we get hit with things unknown like COVID, where basically they told us right off the bat that it is attacking people who already have pre-existing things. They're right on the border. And some people found out too late that something was already there.
Right.
Like you said, some stuff that had no traces.
Right.
I might breathe a little bit heavy, but I don't cause that a problem. And then when something attacks the respiratory system, then you find out that, oh snap, I had scar tissue, I had this, I had that, and I never went and got checked out. So being proactive and not reactive. Reactive can actually have us, saying goodbye to our loved ones a little too early.
I think COVID hopefully will be a wake-up call to many of us, but especially Black men. It's going to encourage you to do two things. One is seeking the kind of guidance and health education and screening that comes from seeing your primary care doctor on a regular basis. But it's also going to encourage you to live a healthier life. Obesity was a huge risk factor for death related to COVID. Diabetes, all of those things are lifestyle related. You don't necessarily inherit it, and there's a lot that can be done about it. So there's the preventative care aspect of it, and then it's just the living a healthy lifestyle aspect of it too.
Yeah, and I mean, and I did an episode on the vegan lifestyle, and you get a few people want to know about that, but not a lot. But my thing is that
they don't want to give it that prime rib.
That's what it is that you don't really want to give up your taste buds. What I learned from one of my buddies, a nutritionist, and hopefully I can get him on here and join me and you on one of our segments with a nutritionist as well, because he was like, sugar. He said sugar actually is like nicotine. He says it's like a drug. He said, when you put it in there, dude, he said it actually wants more. And if you don't give it more, then it will demand and tell you to get me more sugar. He said it does. I don't know all the terminology, so I'm not going to try to act like I know.
flakes and insulin spikes, all that
yes.
stuff.
So, and he was telling me, and I'm thinking, what? And he was like, listen, he was like, you see why people, man, I got addiction to Pepsi.
Right. Yeah.
He's like, if you look how much sugar, he said Pepsi has 45, 65 grams of sugar in it. On a different, go ahead.
No, the people have food addictions in a way that can't be described
Yes.
in any other terminology. It really is an addiction. So, yeah, I mean, your nutritional health is one of the most influential components to all these things. I mean, you're going to get screened, but you don't want to get screened so the doctor can tell you bad news. You want to get screened saying, okay, doc, you know, I've been eating healthy. I've been staying active. Check me out, you know, give me my clean bill of health, you know?
Right. And you won't be scared if you're doing, you know, if you can get about 75 to 80% of that stuff in place proactively, you really won't have a fear. That's really, and I'm just gonna be honest, that's literally when I could just go to the doctor. I literally just told my wife today, I'm having this show, and I was like, I got to set up my checkup. I was like, and I'm 45, so I have to go for the good checkup and then the gross checkup, like prostate, you know, like, and I'm moving us right into our 40s. So the stuff that we should be talking about in our 40s is prostate and colon cancer check. So you're getting checked for this stuff, and this stuff is not fun. Like, it's not I found out it was pretty invasive. It was horrible. It was like, this is really nasty, and I can see why people would not want to do this.
But where's the but?
The but is it takes not even a hair wind of a blow that it is over, and you're checked. So the doctor was like, dude, it literally was like, it was like so quick that you're done. He was like, and you're good. He was like, just that quick. He was like, and he was able to just let me know that, dude, you're good. So he's like, yeah, I know it seems pretty rough. He was like, but look how quick that was, and look where you're at now. You're safe. I'll see you back here in another year.
And let me add a couple of things to that. So we're talking about health overall, but more specifically when it comes to things that would affect our sexual health. So maybe late detection of testicular cancer or late detection of prostate cancer.
Right.
We're all motivated to make sure our sexual health is in tip-top shape. If you need an incentive, let's just make sure that everything's working the way it's supposed to. Because if you procrastinate and you avoid it and you end up waiting until it's too late, the only way to fix it comes with some real consequences and side effects. So go ahead and endure it and get it out the way, just to make sure, you know, that you're investing in your sexual health too.
And I'm glad you even brought that up, because right around at that 35, 40. So that's probably where you're getting that high drop off of your testosterone anyway.
Absolutely.
I mean, it's already gradually going down after 20, after 25, I think. Is it 25 right around there? You're you're starting to go on a decline. I mean, it's pretty high at 25, but you're on a decline from 25 on down or something like that. When I looked at the number on it, I think it was like 25, but the crazy part is that me just talking to some of my buddies and stuff, but it's like, yo, what's up? And I'm like, hey, you know, you're not gonna be 21 in that area in your life forever. You know? And what that does is that then your visual is not the same. You know, you're not like the wind blowing and you like, hallelujah. You know, it's like, you know what I'm saying? So now you feel weird as a man, because it's like, am I losing my mojo? Where is this at? You know, and so we're laughing about it, but I just told him, I was like, what happens is that once your testosterone starts going on a decline, and I just learned this just from working out to boost my testosterone. So like when I started working out and started when I started working out and then doing my homework on it, then I found out that lifting heavy, like shocking those muscles and that blood flow, I mean, it reverses that effect. And so I was like, oh, and then I saw the results, and I'm like, okay,
that's what's up.
So an active lifestyle is literally, when you dial it back to when you're 20,
Yeah.
between 16 and 21, 22, you're at probably your most active,
Right.
because real life hasn't kicked in. So you're like at your most active in your life,
Right.
but your testosterone is at its highest level that you can even ask for.
You're right.
And so at 40, just letting the guys know is really nothing wrong. First thing I would say is get an active lifestyle. Before you go see your doctor and go, I need this and I got ED and
No. We're gonna do this the natural way with no side effects and no bills. Okay, you stay active. You avoid smoking. That also worsens the likelihood of erectile dysfunction. You make sure your alcohol intake is very modest, because excessive alcohol will do it too. Alcohol actually boosts your estrogen. You don't want that, man.
You don't want that.
You don't want that.
You don't want that. You don't want that.
We just want the tea. And your body has this feedback mechanism approach to almost all things. If you're doing more, it'll give you more. If you're doing more, it'll give you more. And if you're doing less, it's like, oh, he don't need this testosterone because he's not working out. So I
learned that. I learned that when me and my wife got into when we really got kicked into the healthy way of that active lifestyle of eating right and working out, is that's exactly what your body does.
Yeah.
Like if you're not using it, your body will literally just say, no, thank you. Right. Like your body would just, your testosterone, you like, where is it at? And it'll be like, yeah, dude, like,
you don't need it.
You should have been working me up like for the month so that I'd be ready.
Right.
But I learned that. I was like, wow. And they talk about, like what I learned is that once I like went off of sugar, and I'm not totally like off sugar, but I eat sugar in my oatmeal. That's my, but I don't eat sugary cereals.
Right.
I don't even eat. Me and the wife just like stop eating cereal because it's either
jam-packed.
it is, and either you have to eat just regular nasty Cheerios or nasty shredded wheat. Like, I mean, those are the only two, because even Raisin Bran and stuff has fructose.
Right.
Like they put a little fructose in there so the raisins can stay sweeter. So we looked at that and I was like, okay, so that's like a lie. Raisin Bran is not that healthy because they put that glaze of fructose on the raisins, so the raisins taste sweeter to make it taste that way, the way that it tastes. So we just took away cereal, period. So, but I want to add that eating broccoli helps lower your estrogen in men. Like it helps balance that estrogen in men. So that's why a lot of men eat a lot of broccoli. Like if you look at The Rock.
Oh yeah, a lot of the bodybuilders. They go hard on the protein.
Ron Coleman,
broccoli. Yeah.
These dudes are like 3.5 cups of broccoli, and they're eating 7 times a day. And The Rock them are eating about 2 to 3.5 cups of broccoli per 2 meals.
Look, because you tell a man that you can enhance your sex life by eating broccoli.
Listen. Eat broccoli, but even like for women, like women eat it and it helps keep balance, because then they're not even over estrogen. The estrogen is just not like over in abundance, because that broccoli actually helps level set that. And that was me just trying to find something that can do it without me going to buy an actual estrogen pill blocker, which I heard is a little rough.
Right. Yeah.
Because you can't, there's no gauge on
exactly
how much is depleting. And when I read up on, the natural way, it was like, if you can eat about 1.5 cups of broccoli, for dinner, we put it in our eggs. I eat spinach in my eggs every morning. I eat mushrooms in my eggs every morning, tomatoes. So we've literally now adapted since the COVID time. And we haven't been doing this we've been working out for years. Like that's our thing. But eating clean, we ate horrible the beginning of COVID. And I was like, okay, so this is not right. Like,
right.
And so we went just like kind of really like cold turkey, like, and we compete. Hey, listen, wives and husbands, get into a little friendly wager.
Yeah. Okay. Okay.
And that will kick it off. If you and put anything on there. I mean, we put something that we want that the other one says no to.
Okay.
So if my wife said, no, I really don't want you to have that, then that's my wager.
Okay. Okay. I like that.
And so on her end, then she gets to put something that I might have said, no, not right now. And then she can wager that. And then what that does is that kicks, listen, you're motivated.
That's motivation.
You're motivated to get, because they already told you they didn't want you to have it. And now here's your opportunity to get it.
Right.
And to make it so funny, dude, we're in one right now. Like, as I speak.
What's at stake? What's at stake? What's the wager?
The wager's this. So last year I got a swimming pool put in.
Okay.
And but I didn't finish around the pool.
Okay.
But she wanted this certain style of finish around the pool. And I was like, yo, that's a lot. Like, I don't know about that.
Sabatine.
So she was like, okay, so it went on, whatever. So I got the kids a golden doodle as a dog. I wanted an American bulldog or an old English bulldog. And so I put that right on the table. Like, yo, if I win and I get to get an old bulldog. And so she was like, okay, bet. So the 31st, like, so next Sunday is our cutoff date, and we'll find out exactly who, wins and stuff. But we've been going hard. And this is the thing, we are in direct competition. But as a husband, I joined her in her workout.
That's right.
As support.
It's a win-win.
It's a win-win. And the thing is this, what man don't want his wife to look smoking hot, and then what woman doesn't want her husband to look smoking hot? And so my thing is that everybody wins, even if we didn't buy anything.
Right.
The win is that when you're able to get back out on the beach and say, well, we had the pool now. So now when we're laying out there and the kids are gone and stuff, it's just great for us both to be able to have that look at each other. You know what I'm saying? Like, I work out anyway just for her. Like, I sweat every day in that gym just so that she can have something nice to look at. We've been married for 23 years this year.
Wow, man. And a lot of times we get so comfortable that we forget to give that gift to our partner. Now, granted, the health part, that's the cherry on top.
That's the cherry.
But you live a more productive life. Your partner gets to enjoy what she was attracted to 23 years ago. Yeah,
I know, right?
That's a win-win, man.
It's totally a win, and really, you're literally just trying to live. You want to complete out what you've created. We're building this life together, and no one wants to see someone actually leave here outside of an accident. Right. You know what I'm saying? Like, accidents are a whole nother ballpark. But to leave here under a health arrest that's preventable. Now, don't get me wrong. There's things that can hit that may not have any prevention or something to it.
Right.
But stuff for the bulk of it, 85%. It's choices. It's bad choices. And we really just decided that we're not going to live the back half of our life just making selfish bad choices because this tastes better. This is this. And then it's so funny, and we're gonna close out of here in like 2 minutes. But the impact it had on our kids was phenomenal, because now my kids were used to eat bacon and all that. Now, since we don't do it, they just adopted it. Like, and we never even told them that they couldn't eat it.
Wow.
So eventually I bought bacon, dude, and I go in there and I'm throwing it away. I'm like, dude, y'all didn't eat it. It was like, yeah, but you don't eat it. Mom don't eat it. So
parenting by example. Parenting by example.
And that's what it was. And it took a couple of years, but of just us being consistent. And then eventually it just rubbed off on them. And I'm just using that, not the kudos to me, but just saying that once we kick that lifestyle in as the man and as the woman,
Right.
And if you're a husband and wife and you have kids, or if you're a boyfriend and girlfriend and you guys have kids together, and say you guys are living together or whatever the case, you can still present something a little bit better even from that. Now, I do say get married. Now, I'm all about marriage, but my thing is that always thinking about your health. Don't build an empire and then you can't last here on earth long enough to see your kids get a piece of it or your grandkids get a piece of it because you are trying to be selfish today. So,
and the truth is, marriage adds 10 years of life expectancy to men. So,
I thank the Lord for that then.
You're already doing yourself a favor.
Oh man, I love it. Listen, man, we're gonna close out of here. This was a great topic. It was a great talk. We're gonna have Dr. Snell back here. I'm trying to get him back here once a month.
Much appreciated, man.
And so we'll come up with something new to talk about. But we're gonna try to cover quite a bit of things that men need to know and understand about health, mental health, physical health, sexual health. I mean, we're going to try to go through all of it. I'm going to see if we can find, some other expert doctors on some other things and see if we can get a little panel so we can really educate ourselves around all of these, areas in our life as men, man. Like I said, we're trying to build, these empires and grind. And I know we're all grinding. I see it every day, man. Everybody grinding, but I just kind of want to be a voice of reckoning to say, hey, take 2 or 3 minutes out of your day, set up an appointment, get to the doctor, get checked out, get that blood work. You have to get, and I'm talking, all 19 vials, let them fill them all up because it's going to, if you get the full workup, it's about 11 and a half vials.
They'll leave some blood.
They'll leave a little bit in there, but you want to get the full workup because you want to make sure that you're covered and you're working and operating in all areas of your body. So, and plus, as a Christian, God requires us to take good care of this temple. So let's not only honor ourselves, but let's honor Christ by taking care of this temple. And this is Quentin and Dr. Snell, and we are out of here. Thank you guys for your time. And if you're checking this out for the first time, or if you're on the rewind, check it out. Leave some comments in there if you have any questions. I can always get these back to Dr. Snell, and then we'll give you guys a chat back about it. All right. Peace out, guys.
Good night.